So, like we said in the beginning, this is a special show. It's an NHS show talking about women's health. And today we're focusing on pelvic health. Now, as you know, this is a podcast. So we're going to edit it up into a wonderful program. And not that this program isn't a wonderful one, because it really is. But we do want you to introduce yourself on our podcast. So I'm going to ask you to do that now. So, Nikki, if we start with you.
Yeah, hi, I'm Nikki Cotterill. I'm a Professor of Nursing and Continence Care at UWE Bristol.
Love that. Yeah. Caroline.
Hi, I'm Caroline. I'm a pelvic health physio, but I'm ASCE as well and work private NHS. So I've got a good understanding of what you can get in Bristol.
Wonderful. Thank you both. That was lovely. That's going to sound great, isn't it, ladies? Yeah. Okay. So let's get straight into this then. So when they said pelvic health, the first thing I thought of pelvic floor. And then I thought, well, what does this mean anyway? Really, pelvic health. Tell us the importance of pelvic health and why do we have to be having this conversation?
So it's very interesting that you say pelvic health is pelvic floor. It is, but it's not only. There is more than muscle into your pelvic area. So it's for everything that is in between and with your joint as well. So it could be organ, it could be muscle, it could be soft tissue. So it's a bit wider than pelvic floor, but definitely pelvic floor is part of it.
And then my area is particularly focusing on incontinence, so bladder and bowel incontinence. And it's good that you ask about what it is, because I think there's a lot of misconception around what actually means incontinence. And this often could be a bit of a barrier as to why people don't access the treatment that they should. So just to sort of spell out really that any leakage, any accidental leakage is termed incontinence. We don't necessarily like that term. And that obviously can cause a bit of a barrier. But yeah, it's about recognising that those symptoms don't have to be tolerated and that you can actually seek help.
Right. Okay. So from a professional point of view, when people talk about pelvic health, what's the first thing that you think people are thinking about?
I think it's incontinence, to be fair. It's the most common symptoms, and it's what people are starting to talk a bit more about it, which is great, and we are here to emphasize that. But it as well, hormone-related, constipation, pain, and all of that is within pelvic health.
Right. Okay. So, ladies, I want to start with incontinence. I'm sure you guys want to come in, but I want to start there. Is incontinence to do with you've just had a baby and you're going to have some problems, or is it to do with age? Or is there another issue that causes incontinence? Because women of a certain age need to know these things.
Yeah, well, I would say it's any and all of those. And there are many reasons that incontinence may present itself at different times across the life course. So it's actually just recognising that that when you experience any leakage like that you start to acknowledge that it's occurring, and that you start to sort of think, what can I do about this, and can I seek help for that? So yes, it is associated with childbirth and carrying babies, and it increases in older age. But I think the bottom line is it's not an inevitability. It isn't just one of those, oh, well, that's what happens when you've had a baby. There are lots of things that can be done to actually improve those symptoms, and similarly in older age, and for all the various reasons that incontinence occurs.
Yeah, and I want to insist that so it's not for women with babies. It's for every woman. You can have incontinence without having a children. So it's very important to acknowledge that. People can find it very hard to talk about it. You've never had kids and they don't feel they should have that problem. It can be linked to chronic cough. It can be linked to overweight. It can be linked to connective tissue disorder. So yes, childbirth is a main one. Menopause is another very huge one, but not only. So yeah, it's just for this inclusivity is just not for this two very hormonal change, but any in the between.
Yeah.
And it's sort of a reason that one of our intentions over the years has been to raise awareness about this at much younger ages, so that women or girls and boys almost know what is normal and what is not normal and the reasons for that, so that they can really be far more aware at an earlier stage. But yeah, as you say, for many and varied reasons.
Yeah, I was thinking of stigma and, the way people think about incontinence. People don't want to talk about it because they might feel embarrassed, but you want to open up the conversation and explain that, this can be normal. This is what happens sometimes.
Yeah, so that was one of the myths I wanted to talk about. It is common. It is not normal.
Okay.
So yes, it is very common. Up to, in studies, incontinence can vary between 25 to 50, 60% and an increase in age. So it is common. It is, doesn't mean it's normal. Doesn't mean it's something we should deal with as just putting a pad on and keeping your normal life. No, it's common, but it's not normal.
And you're absolutely right. Opening conversations around bladder and bowel continence is absolutely key, because that is the way to open the door to accessing the help and the advice and information. But not so normalising the conversation around bladder and bowel leakage is key. But as Caroline has said, acknowledging that it's not normal. But certainly we need to talk more and more about our bladder and bowel health.
Well, come on, ladies, let's open up the conversation.
All I can say is the fear of the trampoline when you've had a child and when your toddler is going, can we have a jump around? And you go, okay. And then you're going, just hang on a second. Yes, so that can occur, obviously. But I remember hearing lots of talks about all you need to be doing is when you're cooking, when you're going about your day, to just practice by holding and releasing and just getting used to, or even if you're stuck in traffic. Am I correct in saying that? Just exercising the muscle?
Yeah, definitely. I want to bounce literally on the trampoline. It's just to say, like, most of the time, trampoline is the issue, not you. I think as well, acknowledging expectation with trampoline, 80% of trampolinists have some urinary incontinence. So definitely the problem is trampoline. Okay. You should be able to bounce a bit, but, it's still an issue. Then, yes, obviously exercises is a first line of treatment for incontinence. And yeah, it's like any other exercises. Continuity is key, and variability, as you said. You can do it sitting, standing at the kitchen. Like, make sure you fit it into your life in different type of position.
And the other thing to acknowledge is there are different types of incontinence. So you may have heard people say, when they get the key in the door, or that when you've got to go, you've got to go. And pelvic floor exercises can help with that, but there are also other things that can help with that. So it's almost, if you've been trying pelvic floor exercise and it isn't getting better, it doesn't mean that it can't. It might just need a different approach. So it's acknowledging that it's quite complex, and that's why it's important to get to the bottom of what's actually happening.
I remember my mother-in-law, she must have been in her 70s. I think she sort of felt she was becoming a bit leaky, incontinent, and she wouldn't go out for the day. And that was such a shame, really. She limited herself, and I'm wondering what could have been done. I mean, can somebody in their 70s get help, and what sort of help? I mean, she just accepted that the doctor wouldn't do anything, and she was stuck with it, and this was it.
So, yeah, it's a very good example. So, and it's why when you say, why is it important? It's important for that because it does impact a lot. Mental health, quality of life. It's not just incontinence. It's not just the symptoms. It really impacts women's perception of themselves and men. And they just limiting themselves to a very, very tiny safe area. So, and that is a shame because we can do plenty of that. Age doesn't matter. There is always solution. Different one for everyone, but always a solution.
I wanted to talk about the mental and the physical, because when you, Nikki, mentioned about the key, it just triggered me. Every time I get home, I want to go to the loo. I put my key in the door, and the first thing I do, I drop my bags and I go to the loo. Is that because, I'm just thinking of the mental and the physical. Is that something that my body is trained to do mentally, do you think? I've never thought about this before, but it's a conversation I want to bring to the table.
Yeah, we definitely do learn habits and then repeat those habits. So actually when that kind of incontinence is occurring, there's a thing called bladder retraining. So about extending the amount of time your bladder can hold. And that's often better done with support and services such as the bladder and bowel service to really understand what's going on with your bladder and do that appropriately. But it's absolutely right. There are habits we learn and that we can relearn and retrain.
So you speak about the keys. It's actually called the lash key syndrome, and it's as well very.
I've got a name.
It's as well valid for water. When people open the tap or wee under the shower because
yes.
you just can't help it.
Yes,
It's the
yes.
same type of incontinence.
Wow. And the other thing I wanted to mention was drinking a lot. So if you know you have an issue such as this, you tell yourself you shouldn't drink so much because I don't want to have that problem. And then everybody says you need to drink a lot of water because it's healthy for you. So there's a bit of a paradox, a bit of a confusion there.
Yeah, absolutely. And I think, and going back to your story about your mum and the stories I've heard researching in this space for a long time is how much people restrict their fluids or restrict their diet because they fear an accident. And you're absolutely right. We need to drink a certain amount to make our body work in its optimum way. I think a lot of the lifestyle advice that's out there is overestimates how much fluid we need to drink. So there's that balance between drinking sort of, excessive amounts of water and then having a problem where you do have some leakage. So balancing that. But there's also an element to what we drink. Caffeine is known to be a real stimulant of the bladder. So it's a really good idea if you're having these problems to try cutting out caffeine for a couple of weeks.
Wow.
And if it doesn't make any difference, don't deny yourself your caffeine any longer. But it can be a trigger and it's worth trying these things. And that's why we're really keen to raise the message, because there are all these things you can try at home and sort of lifestyle adaptations and modifications to see if you can really gain that control back.
Yeah, just a fun fact. There is caffeine into chocolate. So I'm sorry to say, you need to cut down on chocolate as well.
We didn't want to hear that.
The truth, only the truth.
Yeah, the truth hurts.
I was with my niece on the Saturday and I thought, bit of research then. So I said, Ruby, do you know what pelvis is? And she looked utterly blank. And I said, well, just Google it. And she said, is it your hips? And I think there is a sense of not quite ignorance, but not awareness of what we're actually talking about. And I don't think people talk about pelvic conditions. Other than my mother, she was a great lover of Elvis the pelvis. So pelvis was a word in our family. But I was interested in you talking about restrictions, either what amount of liquid you take in, but particularly, Suze, people who won't go out. And I was actually on a walking group with a lady who had a key, a radar key, the universal key scheme. And this enabled this person who had a few problems that way post-op to be able to keep walking. She was part of the national scheme. You have a key and you can access closed, public, disabled toilets wherever you are. And it opened up life for her, and I think awareness is one thing. Perhaps we all need to know where to squeeze, and maybe talking about it and sharing means more people with perhaps Crohn's or IBS symptoms or whatever can still carry on a normal life. But I don't think many people know these schemes are out there or what help and support they can get. So where do they look?
No, well, you're absolutely right. And that the whole thing is shrouded in secrecy, and that obviously then limits what people can do and can access in terms of unlocking their life. So you're absolutely right. In terms of the keys, they vary about how you access them. But Bladder and Bowel UK has a website and they have signposting to how you can access those keys. And also, if you go through your local authority, your councils, they can inform you how you can access them. Sometimes there's a small charge, few pound, and sometimes not. But yeah, the information is definitely out there and to access that. The one thing I wanted to raise as well in terms of kind of these top tips and the conversations and the information that can be had if you almost know somebody who experiences it, you kind of, the whole world unlocks to you in terms of all of their top tips and what they've experienced and what they share. So we locally brought together an app called the Confidence app, which brings together all of that information and advice around kind of thinking about work life and travel, and as well as all of the practical things like what is going on in my bladder and what is going on in my bowel. So it's entirely free. It's approved by the NHS and it's intended to be like a one-stop shop to have the the way I describe it is almost the conversation my friends might have with me is what's in the app, and exactly like your friends, sort of that insider knowledge. So it's definitely worth downloading that for further information.
Oh, give us a bit more information about the app. I'm just trying to think how that works and what it looks like.
So essentially, it's an app on your phone and completely free to download from the Apple Store and Google Play stores. And it was developed with a national team of experts. And by experts, I mean people who have clinical knowledge, but also patients and the public. So we really speak to the messaging that needs to get out there and in really accessible language. So it basically tells you everything all about what's going on with your bladder, your bowel, what you can do to help, when you might seek help, who you might seek help from. So really aiming to demystify the whole thing around bladder and bowel leakage and kind of open that door.
Caroline.
It's interesting because we met a bit earlier and we chatted a bit. And actually, we do have a website as well as a physio around Bristol. So it's very local. It's called My John Health Hub app. Although it's not an app, it's a website. There is a pelvic health section, but you as always back and elbow, and so it's a bit more whole body. But there is a very good pelvic health section where you got information on how to perform pelvic floor exercises and how to do all of this lifestyle management you can do to help yourself and when to do that. So when we say information is out there, it is. You sometimes need to look for it a bit.
Okay, well, this is it. You do have to look for it, and I was going to ask a bit more about that, but.
Well,
Marie,
I was just curious, is there just one exercise that you could say, apart from cutting down caffeine, so I'm already in trouble because I like my tea and coffee, but is there one exercise that you think we can just do very easily while we're, there's women listening to this program now who are literally sitting down with their cup of tea or cooking their breakfast or whatever?
Yeah, so it will be pelvic floor exercises. It's to be done 3 times a day, so definitely every time you get a chance you can do that, but to be efficient, it's not to be only in sitting. I insist. Sitting is a great one, but not only. So you're right, it's about squeezing, but it's not just squeezing, it's a bit of lift, because the way your muscle works, they kind of block your urethra to your front, so you really need to have this back to front element as well. I'm using my hands to explain exercises so the women in the studio can see me moving everywhere. But yeah, so really think it's from the back to the front. You don't want to just pinch the urethra. You really want to engage your back passage. So it's back to front. I have a colleague who uses eating spaghetti from your back passage. I love that idea. Because you really have this vacuum element. You can pick up a blueberry from your vagina, anything that make you feel this lift from the chair. So chair is a very good space to start because you will have a feedback from the chair. So it will give you a bit more information of what you're doing. And you really should feel this lifting, this feeling a bit more light onto your chair. And when you release, it's going down. And it's okay to come down. People sometimes are afraid of going down because of various symptoms and sensation. But it's okay to go down. Your pelvic floor can't be up all day long, especially when you're sitting. So just think about this movement. Rather than just a squeeze. Have this nice movement up, this movement down. Once you found it, you can hold it, because obviously pelvic floor are postural muscles. They need to hold. So try to make them working in endurance. So try to reach your 10 seconds. Break news, if it's 8, 9, 11, 12, it's fine. Don't be on your 10. It's just easier to say 10 seconds, hold, release, 10 times. And then you've got your session, that will be the one thing that you can do easily everywhere in any position.
Amazing.
And the one thing I would add is you're absolutely right when you said earlier about keeping doing it. It's a muscle. It needs exercising. It needs repetition and needs building up. But also a top tip in terms of managing expectation is this isn't a quick fix. You won't see a result in a fortnight. So don't give up just because it hasn't changed anything. We're talking of kind of 3-4 months to see some change, and then really sticking with it for life, becoming a habit. So that then helps people, I think, to stick with it rather than give up, and then realise the results it can show.
Wow. Well, we've virtually come towards the end. We really have. Just finally, you did say that you want to start these conversations. These are conversations that women should be having, but they are conversations that some women may feel uncomfortable about. What's your last bid for these conversations that women should be having about pelvic health?
I don't know. It's just part of your body. So I just acknowledge it. Well, it's easy. It's very easy for me to say. I think it's culturally, as I said, I'm from France, it's much more open. So yeah, there is no shame, no embarrassment. It's just part of your body like anything else.
Well, it has been a fascinating conversation. We want to thank both of you for coming into the studio and sharing your knowledge and expertise about pelvic health. We've all had a pelvic health session today, haven't we, ladies? It's been
I've been doing my
great.
exercises
as we speak, and you're suggesting 3 times a day. Well, we've started ours, so great. Thank you so much. So we've been talking to Nikki Cotterill and also Caroline Escande, this special program all about pelvic health for the NHS. Thank you so much.